The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic today. A lot of people, in fact, everybody's talking about it. Smooth sculpt liposuction. It's using traditional tumescent liposuction with ultrasound to dissolve the fat for better results, lower downtime with the patients, and very predictable results. Safe. With us, we have an expert on the topic. He is the National Medical Director of Sleek, and he's here to talk about this new form of liposuction. I want you to welcome to the show.
Thanks. Pleasure to be here.
Okay, so tell me about Sleek's Smooth Sculpt. This is something you've named. What is it? Is it gimmicky? I mean, does it work?
No, absolutely.
How is
works.
it different than traditional lipo?
Traditional lipo was almost like a vacuum cleaner, a little instrument going in and plucking out, grabbing fat and kind of pulling it out.
All right.
This way, it takes that aspect out of the equation. We use the wetting technique or the tumescent solution. We take the ultrasound, which uses high-frequency sound waves to dissolve the fat, melt it, liquefy it, make smaller particles. Also gives some skin tightening, and it's attacking the fat. It's aggressive, but it's delicate. It's not damaging nerves, blood vessels, other tissue, making it much easier to pull the fat out. We can be more aggressive, get more fat out, and sculpt the body, as opposed to just removing the fat. We're actually tapering the results, getting nice results, smooth skin, tighter skin that you didn't used to get. There used to be some concern that liposuction would cause some of the skin to sag more. We're actually getting skin tightening and the opposite effect with our technique. And we're also pre-treating, and we have treatments afterwards that helps the healing process.
You guys have specific protocols at Sleek.
Specific protocols.
Secret protocols? Or you can bring them up on the show.
Specific protocols for each body area, each part of the patient type. We're constantly perfecting it. We have meetings. We constantly trying to improve excellence.
Let's begin with the different areas of the body that this works best for.
Pretty much head to toe. Like I said, there's areas that traditionally we wouldn't treat with regular liposuction, starting with the chin or the neck. Great area to treat, especially young patients. They have a little area of fat, almost looks like a double chin, almost looks like they're heavy in clothing. We treat the area, sculpts the jawline, gives them a more youthful appearance, gives the men a stronger appearance. They're much more confident. They don't need a big facelift.
All right. Now what about arms?
Arms are another great area. I get a lot of women who either they have their own wedding coming up, or they're going to be a bridesmaid, or something that
their daughter's getting married.
Some sleeveless dress or something that they don't want their arms to show, that they're pretty happy with the rest of their body, but they hate their arms.
Okay.
Or even sleeves. They can't find the clothing that fits right because their arms
But
out
the
of proportion.
arms treat well, though, with this?
Very well.
With this technique? I mean, it bounces back?
Yes. And I hate the arm lift surgery because it used to leave a big scar down the middle of the arm. I'm finding that I can avoid that in a lot of women because the smooth sculpt gives some skin tightening and some lift to the area. So this
ultrasound?
Yes.
Okay. That's what's helping? I mean, is it heating the area? So I understand a little bit how it works?
There is a little heat. High frequency sound wave sends out sound waves that dissolves the fat, breaks it up. Also stimulates with the heat the collagen underneath the skin to tighten.
Okay.
So it's also making the fat easier to come out, tightening the skin, get a little lift. The area is smaller. It heals very nicely.
So arms are a great area?
Great area.
Okay. What else? What other areas?
Bra strap or upper back. Very difficult area. The skin's a little bit thicker back there. Traditional liposuction is very hard.
On the back? People are doing this for their back?
Yes. Very thick area of fat, thick area of skin. Did not respond well to regular liposuction. This works great. A lot of women, after they get the sides done, they don't like the way the clothing fits. They're wearing jogging bras, thick, big,
So they get their
clothing.
abs and love handles done.
Yes.
And then their back sticks out.
Yes.
And they've got to come back and say, you got to do this, doctor. Is that how it happens? Or?
Yes. A lot of times, or they come in with that area as well.
What about legs?
Legs work great. Typically outer thighs, inner thighs. Women exercise, they diet, they're down to their lowest weight, but they can't lose that little area. Drives them crazy. They won't wear shorts, they won't wear a bathing suit, they're self-conscious in skirts, formal gowns, tight dresses, they don't like it. They come in, we treat the area, it's gone, it's taken care of. They feel much better.
So ideally, it's a person that, let's say that they're running 10, 20 miles a week, and they still have a little pocket of fat or inner thighs that they just can't get rid of. I mean, is that who you want the most?
Well, those are
these kind of people?
Traditionally,
diet, exercise is just not working.
Those are the traditional patients for liposuction. Problem areas that they can't get rid of with diet and exercise, whether it's genetic, whether it's some other component. We've expanded that a little bit over the years to help people get a jump start, treat some problem areas, give them a head start, help them with their diet and exercise, push them a little bit, that they'll see results that they weren't seeing before, because the areas that's hardest to lose but easiest to gain is gone. So that their hard work is going to target the rest of their body a lot better.
What about buttocks?
Typically, we'll treat the area, the back of the thigh, just under the buttocks. It's got the name the banana roll, or maybe in a bathing suit. It's unattractive. Smooth that out, gives a lot more contour definition to the buttocks. Looks great.
Okay, with this smooth sculpt, by the way, would you challenge other doctors and you'd say, hey, you know, when using this ultrasound combination with tumescent liposuction, that you're going to get better results? I mean, are you convinced of that?
Absolutely. I've used every different type of liposuction procedure, and I really like this. I'm excited. I really like the results that we get with the smooth sculpt.
Okay, and who's a candidate, by the way?
Well, pretty much everybody's a candidate. Everybody's got that has problem spots that they can't get rid of is a candidate. We don't like to do it for weight loss.
Okay.
We don't want that to be the primary focus, but if we're treating problem spots that don't respond to diet and exercise, or people are frustrated with that they can't get rid of, they're an ideal candidate. And that encompasses a broad range of people, men, women, young, old, different body parts.
Okay, now in all sleek, and I did my research, you guys have board-certified plastic surgeons that are doing this procedure.
Yes.
What are your, now obviously you have a bias. You think they should be board-certified plastic. Tell me about that.
Somebody that does liposuction should do a lot of it and should be very proficient at it with different scenarios, different challenging patients, different body types, different body areas, and be proficient in it to get the best results. We all do the same thing, train the same way. We actually will talk about the procedures, we'll have meetings, we'll try to perfect the technique.
You and other sleek medical doctors?
Yes.
Okay.
Yes, we're constantly trying to perfect our protocol, our technique to get the best results.
Okay, you brought photos. What are we looking at here?
Well, some of these are not my patients, they're from the manufacturer, but they're a great example to show some of the typical patients that we treat.
Okay.
The first patient shows kind of like a little mommy pouch, a little bulge after pregnancy that's resistant to diet and exercise, drives her crazy, can't wear low-cut jeans, not comfortable in the bathing suit. So with this patient, if somebody came to me presenting like this, we would treat her through some small incisions, melt the fat with the ultrasonic, and then pull it out. Treat her with our smooth sculpt to help her speed up the recovery and the smooth skin. Take a look at this after picture.
Very nice.
She can wear, now she can wear her low-cut jeans. She can wear a bathing suit. She's excited. She's finally getting some results from diet and exercise and looks years younger.
Now you say it gives them leverage to start taking better care of themselves. What do you mean by that?
Absolutely, because they finally see some results. People get very discouraged. They diet, they're sacrificing, they're not eating their favorite foods, they're working out, they're spending hours in the gym, and they're not seeing the results that they want. It gets very discouraging that they're putting all this time in, working hard, and it seems like it's pointless to them. So we help them out here, get rid of these problem spots that they've had for years, and the results just seem to come to the rest of their body, and it encourages them, and they're getting great feedback, they're feeling better. So yeah, let me show you this next one. I really love this one. This is more common. You can see in the before picture, I mean, she's not really overweight, but she doesn't have that hourglass type of figure. She kind of like has a straight figure.
Can't even tell that's a woman.
Yeah, kind of looks a little bloated, almost looks like it could be a man or a woman. You don't know how old. Looks like it could be somebody who's a little older. She needs a little help to lose the toughest to lose fat, which is right in that waistline area. So we're able to help them out with our procedure. And take a look at this after picture. It's a tremendous difference. She looks athletic, young, sexy.
Incredible.
Would have no problem wearing a bikini now. And you definitely.
I'm saying incredible, by the way, and I'm not trying to side with you. I'm just, and people need to know, if you're just tuning in, this is a real interview. We're talking about this new type of liposuction. You're calling it smooth sculpt, and these photos are examples of what somebody possibly can get. Okay, so you take a person that looks like that, and now they're totally feminine. That looks like an athletic body.
Right.
It really is amazing.
Yes, and there's no confusion. That's a woman's body there.
So they have to diet and exercise a little bit to get to that point.
Yeah, and a lot of them don't mind now. They're seeing these results. They feel better. They want to maintain their investment. They've had the procedure, got rid of these genetic areas that they couldn't lose, and they want to maintain it, but they see the results now. So it pushes them, motivates them to continue it. Now here's another patient, obviously a female, but take a look around the belly button area, the waist area. The before picture looks like she could be somebody much older. Common area, can't lose, very resistant. First area to come back when you put on weight. And look at that after picture. I mean, she's got a nice hourglass shape around her hips, flatter tummy, muscular. You could actually see the muscles a little bit better underneath there. She's feeling better about herself. She's got a bikini. She's got suntan. She's out there.
I mean, do you see that a lot? I mean, you know, somebody comes in, and all of a sudden they come back in with a, you know, with a tan on the, you know, on the follow-up appointment, things like that, dressing differently.
Yeah, it makes a big difference. Big difference for them, that they just have the confidence to wear things that they couldn't wear before, and it's contagious. It spreads to the rest of them.
Could you sculpt out some abs? I mean, if you get a semi-fit person or a fit person that just can't get rid of, I mean, could you sculpt out some abs?
Yes.
Is it possible?
Yes, it's possible. Yes, we do that. Obviously in men more than women, it's more attractive to have that, but the women, we could sculpt the abs out and still keep it feminine. Here's another patient, same kind of thing, very boxy, square torso. You know, is it a man? Is it a woman? We can actually sculpt in, give them curvier hips by taking away the straight-looking torso and give them a nice curvy figure.
Now, do you go all the way around, or you just hit the front?
We go from the front, the side, and towards the back. So it's kind of all around, but I want to maintain the proper anatomy in the back. But yes, we do target where it's needed.
Now we're going to take a quick break. We come back, moving to other areas of the body, neck, the bra strap area, legs, thighs, things like that. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking a hot topic today, smooth sculpt. And that is tumescent liposuction combining with ultrasound, that literally dissolving, according to Dr. Haramis, dissolving the fat, which makes it easier to pull out. Do I have it, do you think?
Yes.
Do I have it right? Okay, good.
It.
We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, smooth sculpt liposuction. With us, we have an expert on the topic, Dr. Haramis. Okay, so you have a lot of photos. We've talked about the abdomen. Now you have photos, and this is what? What area of the body?
So about the back, or the bra strap area, or the mid-back, kind of in between the hips and the armpit area.
Okay.
Very troublesome. Certain clothing they can't wear. The area is accentuated, very tough area. Some genetic component that they just can't lose this area. Okay. It's a great area to treat with our procedure. It gets rid of the fat permanently, allows them to wear nicer fitting clothing, not be self-conscious about it. Let's look at this picture. Before, she's not a heavy person, but has these obvious areas that are very troublesome, not too attractive. And in the great after picture, they're literally gone, and you can see she's got the outline of a very skimpy bathing suit there. She obviously feels better. Not having those there, she looks younger, more athletic.
Is this a common area, by the way, the bra strap area?
Very common area.
Really?
Yes,
so
very
every
common.
week you see something like this?
Yes. It's also common after we've treated the flanks already.
That's the love handles.
Right, or the hip area, that once those are gone, that the bra strap area becomes bothersome.
Now, do women, give me the inside scoop here. Are there women that avoid, I guess, certain tank tops or certain this or that because of this bulgy area?
Absolutely.
Really?
Yeah, especially a bathing suit, or they almost have to wear like a jogging type of bra that's very big and very tight in the area to hide it, and they can't wear certain dresses or shirts or strapless gowns, and very troublesome to them.
Now the back fat, is that a tricky area? Is it tougher for you, more technically demanding, or is it just like any other part of the body?
No, it's a tricky area because the skin's very thick back there, and the fat tends to be very fibrous and thick, and that's where this smooth sculpt technique is so great, because it really breaks up that thick tissue. Regular liposuction has a very hard time getting out that tissue. Here's another patient. Same kind of thing. She's got this little area, lower, kind of in between the upper back and the hip area, but it's kind of sticks out. It's.
Is that rare, by the way? I mean, I don't see that kind of a look.
Well, we don't see it because they usually cover it up or don't give you the chance to see it. They're not out at the swimming pool or the beach in a bathing suit because they're self-conscious about this area.
Good point.
But we can get rid of it. It's not a problem for them anymore.
Are people surprised, by the way, they don't know their options? That means they come in for just maybe abs and flanks, and then you say, you know, we could take care of your back too? I mean, how does that come up? Or is it pretty much the word on the street that they know that the back area is common?
A little bit of both. Some come in that they just hate their back, they can't get rid of it. Very common, we'll treat other areas like the sides, the flanks, the love handles. And then they'll come in and looking at themselves in the mirror say, oh, now my back really looks bad, or that's an eyesore now.
And it bounces back. I mean, the fat will never come back in that area, right? I mean, you remove it, it's gone. Is that true?
It's true. As an adult, you don't make new fat cells. So whatever we remove with liposuction is not going to come back in that spot.
All right. Now, what about that one? I could see that from here. That looks really unusual.
Yeah, here's another one. Yeah, this is a very unusual case. Very tough. This would be an extremely tough case with regular liposuction. Probably have some colleagues who would recommend surgically removing the skin with big scars in that kind of case. But with the smooth sculpt, it's able to treat that area with small incisions. Nobody will know that she had it done, and it's a tremendous difference in the after picture.
So technique, a lot of technique in this.
Yes, especially the back area as well. Each part of the body, the area, has to have its own technique. Do we have time to show you a few male photos?
Yes.
We have some abdomens and some chests. This gentleman's an ideal type of patient. You can see he's gotten down, he's diet, exercise, he doesn't have a lot of fat.
He's not really a fat guy.
No, but he doesn't have the definition that he wants to have after all the working out that he's done.
Okay.
He's working out, he's athletic, but he probably have to starve himself to get the definition that he wants. So he comes in, a little procedure under local, walks in, we get rid of that fat permanently, and it's able to show off the muscles that he's been working so hard to. So look at this after picture. He's sculpted, he's fit, he's ripped. Not a lot of fat's taken out, but it's given him the result that he wants.
That is a great result. Doesn't look like the same person. Obviously, this person now is working out, things like that.
Right.
I mean, is that common, though? I mean, look, obviously this interview is real, okay? Am I going to have to put results not typical all over this program? I mean, can you expect results like this?
Absolutely. I mean, he's not my patient, but look at it. He's got a small area of fat around the belly button area. He's gotten rid of that. It's not going to come back. So now he's working out more, probably. He's showing his muscles off. He's fine-tuning his diet. He's really conscious because he sees results, and he doesn't want those to go away. So he's going to work even harder, and he's motivated now that you can actually see the results.
Okay, male breast. I know you brought some photos of the male breast.
Male breast, another area. Traditionally, it's been very tough to treat with liposuction.
Why is that?
There's fat, but there's also breast tissue, which is very firm. And traditionally, to remove that was an invasive operation with a scar typically around the nipple, long downtime, painful. This way they walk in, we do the suction. Smooth sculpt will remove the fat in the area, tighten the skin, and give a pretty dramatic result. A lot of these gentlemen are very self-conscious and have been for a long time. You've probably seen them wear a t-shirt at the beach or the pool. They don't let anybody see them without a shirt on. Very self-conscious, probably got teased.
I mean, do they tell you that they won't take off their shirt?
Yeah, and teased and self-conscious at the gym, in the locker room. They don't want anybody to see them.
Man boobs. It's not good, right?
Yeah, it affects the clothing. Maybe they wear a shirt that's a little bigger, so it doesn't show that off, but then they don't look as fit because they're wearing larger clothing to hide this.
Okay, so smooth sculpt, using the combination of, for people just tuning in, we're talking about smooth sculpt, ultrasonic liposuction with traditional tumescent technique, great for the male chest.
Yes, gets rid of the fat that's there, contours the breast down, instead of like a womanly or an older man looking shape that allows it to show off the chest muscle underneath, give them more masculine, more youthful physique, and the problem area that they were worrying about goes away, and happy to say a lot of them say that they go to the beach without their shirt now.
We're going to take a quick break, and we're going to come back, and next, you brought a lot of neck photos. What are your comments about the neck and how well it treats?
Great area, especially in young people, starting a lot younger. Quick procedure, great healing, great results. Nobody can tell what you had done. It's tremendous.
Okay, good. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. We're talking about smooth sculpt, and we're here with the National Medical Director of Sleek, and it's Dr. Haramis. Up next, some really, really dramatic neck photos. They look like they had a facelift. It's just their neck.
Just their neck.
Okay, we'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, hot topic, smooth sculpt liposuction. It is very popular nationwide, combining tumescent liposuction and ultrasonic lipo. Did I get that right, by the way?
Yes.
Okay, good. Now, the neck. I guess this can be used throughout the, throughout the body or wherever you have this unwanted fat. But 45-minute procedure, an hour and a half procedure, max?
It's a great procedure. It's very quick in the neck. Can also treat young patients, patients who aren't ready for a facelift or anything invasive. It's a little walk-in, walk-out procedure. Small incisions, they're hard to find. Small instruments, we target the fat, it's gone. You get some skin tightening. May even help maintain going forward that since you're starting this earlier, that the skin will stay tight. Nice jawline, crisp.
Are there people that, you're a plastic surgeon, that come in, they self-diagnose, they think they need a facelift, but really all they need is a little neck lipo?
Yes.
Okay.
Especially if they have a little waddle there, or a little protrusion, almost like a double chin. If they're young, their muscle is good, the rest of their face hasn't started to sag or hang down yet, there's no reason to do a big invasive procedure. This is great. They walk in, it's a little 20-minute procedure, half hour.
Okay, let's take a look.
We got some photos here. I can run through them for you. It's a young lady, but she doesn't look it. She's got this tremendous area of fat under her neck that even with a facelift would probably be tough to get rid of that. Just come in, little procedure, melt the fat, tighten the skin, smooth sculpt. She looks her age instead of looking like an older woman.
So how do you do it? I mean, how do you go in with the neck?
Little tiny incision under the chin or behind the ears. Again, the same technique, wetting solution, same sleek protocol. We all do the same philosophy, same approach. Melt the fat, tightens the skin at the same time. Use a very small liposuction cannulas, take out the fat. And it usually get more skin tightening than actual fat removal.
So a lot of skin tightening.
Yes.
Now this neck, in this particular case, and I understand this is not your patient, but a sample from the manufacturer, but that fat's gone. I mean, the chance of that neck kind of blowing out again, I'm using that term, very, very slim?
The fat's not going to come back there.
Okay.
She's going to get some additional skin tightening, so hopefully turn the clock back even further now that she's started. She just has to maintain herself going forward. Here's another one. Same thing. She looks like she has a double chin, looks years older than what she really is. Does not look youthful, looks heavy. Little quick procedure, get rid of that excess fat, tighten the skin. There's no cutting, minimal incision, small cannulas.
Looks very fit. Looks good.
Looks great. And the best thing is she'll be in clothing. People think she lost weight and won't be able to figure out what she did to look so great.
Is this more men than women are getting this, by the way? I mean, because men wear collars, or is it a mix?
It's a mix.
Okay.
It's a mix. But we are seeing a lot more men, because typically for facelift, wouldn't be able to address some of these problems. It would be overkill. So they wouldn't have anything done. Here we can offer them a great in and out procedure that's going to take care of that very easily for them. Here's another one. As a man, as you were talking, men typically have a little thicker skin because of the hair follicles or the beard. And again, it takes years off of him. He has a double chin. He's not heavy, but his neck and his chin does not go with the rest of his body.
Very nice, very nice.
Yeah, it looks great. He's got some definition in the
looks
after
like computer
picture.
imaging. I mean, this is an actual photo of what can be done. So how high do you go up? I mean, do you hit the jowl area? What do you do?
Well, the neck is very easy to treat, and a lot of people don't realize until maybe they see a photo of themselves from the side, because they're not looking that way, and they say, oh my God, I look like that, and they hate it.
Okay.
So you're talking about people going to a party, maybe they look nice, but they can't hide the neck, unless they're wearing a turtleneck or something, which in the summertime they're not going to do.
Okay.
Very self-conscious, but it's easy to fix. A little quick procedure gets rid of that fat permanently, gives them a nice, crisp jawline, more youthful look, more confident.
Makes it look much thinner, obviously.
Much thinner. And in the case of men, usually makes them look stronger. This gentleman here, his pre-op photo, looks like he's heavy if you just saw him from the neck up.
That's right, that's right.
But he's not really heavy, he just has fat in the wrong place. So it's a great procedure for that. Targets that fat, removes it permanently, restores the jawline, crisp, strong jaw, makes him confident, it looks great in clothing, it looks fit.
And the chance is his neck will never drop back down.
Well, the fat won't come back. He's already gotten some skin tightening, so he should get a jump start on that process. Normal aging process will continue, but it shouldn't be as severe in his case.
Okay.
Here's another one, pretty dramatic result. Again, no chin, no neck. Just looking at that without seeing the rest of her face, looks like somebody much, much older.
Okay.
And then great result post-op. There's some definition, some contour to the neck, to the chin. She looks her age, feels better, is wearing her hair different. Great result. Here's another one, same thing. Self-conscious, the double chin. Feel like their whole body is heavy. They don't look right in clothing. Huge difference. You can even tell from the expression. She's kind of almost frowning in the before picture. The after picture, she's smiling. She feels good about herself. She can wear clothing. Another one here, a little more subtle, but big difference for the patient, though. Doesn't take much. Here's another one. We'll just go through these. Similar thing, no neck.
Big difference there. Just a very little difference makes it, gives them Nice chin, nice neck.
Huge. Here's another one. Same thing. Takes years off.
30 pounds lighter,
Yes.
it looks like.
Same thing here. And we also have men that once they start getting into their 40s, sometimes they have a little thickness in the area just from the gravity is a frequent area that'll affect that. This will come in, take care of that without big unsightly incisions and scars and all the downtime of a facelift, which sometimes doesn't look natural in men anyway.
Okay, final message. Somebody watching this, they're still maybe afraid of liposuction for whatever reason. What is your message to them about smooth sculpt?
Well, it wouldn't be normal not to be afraid.
Okay.
That's just not normal. But smooth sculpt, quick results, shorter downtime, faster healing, smooth skin, get rid of the fat permanently, get some extra skin tightening. We have pre-treatment and post-treatment that helps the whole process. Much better than regular liposuction, especially problem areas like the back, under the bra, male chest, outer thigh, even the abdomen and the sides. Chin, neck, previous areas you wouldn't even consider using regular liposuction for do great.
But why lower downtime? That's the part. Help me understand that part.
Well,
I've asked before, but I want to know.
Remember what we're doing? We're putting the numbing fluid in, small cannulas. The ultrasound is going in, it's breaking up the fat, smaller particles, it's less traumatic to the patient. The regular liposuction was kind of thrusting the cannula in and grabbing clumps of fat and
Okay.
traumatic to the tissue, causing bleeding, discomfort. This way the fat's ground up, it's morsellized, it's softened, it's melted. It doesn't traumatize the nerves or the blood vessels or anything. It's easier to take the fat out. There's less trauma. There's less blood, hardly any blood.
So the patient...
Very little bruising, very little area to heal. They kind of get a jump start on the healing process.
Great stuff. A lot of photos.
I had a lot
Thanks
of fun.
for coming on the
Thank you.
program.
Appreciate it.
Now, if they want more information, they can go to your website.
Go to our website,
Call
email
one of your
us,
centers.
call us. Be happy to talk to them, answer any questions.
Okay, good.
Whatever.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again or have more questions about liposuction, you can go to our website at wellnesshour.com, and in our search, just put in sleek or liposuction. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.